Good morning. Today we are going to do a swelling, and that swelling is pretty common, and that is ganglion. Questions usually asked by examiner, they are: describe your clinical findings, what is your differential diagnosis, what is your diagnosis, justify your diagnosis, how will you confirm the diagnosis, what is the treatment, why do you want to operate, what are the complications. This is the general line of questioning which an examiner asks, but obviously he may ask some questions which are particular to the swelling. You see, if you see this hand, this is ganglion. And interestingly, you must see this thing. In this picture, the hand is flexed to make it more prominent. A ganglion is a cystic myxomatous degeneration of fibrous tissue. Since it is cystic myxomatous degeneration of fibrous tissue, so they are common where there is a lot of fibrous tissue. For example, around the joints or along the tendons. It is important to remember ganglia are not a pocket of synovium protruding from the joints. Now I'm going to do a role play and assume that this is a patient whose history and examination I have been asked by the examiner to take and do. So I am thinking aloud. So by taking history, I am going to ask this patient, when did he first notice the swelling? How has it progressed? What complaints this swelling is causing? Has he received any treatment or not received any treatment? What does he think of it? And during examination, I am going to see the site, the size, the shape, obviously the surface, the skin over it, then when we touch it, the tenderness, press it more, then its consistency, surface, edge, and then specific like fluctuation, transillumination, and what is the state to the surrounding structures. And since it is in the arm, in the hand, so therefore I have to see the axial lymph node also. So assume I have taken the history of this patient, and now I am waiting for the examiner to come and ask me the questions.
Hello, Mr. Shukar. Are you ready for the questions?
Yes, I am ready, ma'am.
Okay. Describe your clinical findings.
Well, ma'am, this is a young patient, and he noticed a lump on the dorsal surface of the wrist a few years ago, and he remembers that he first noticed this when he used to wash the clothes and wash his hands. It has progressed slowly over the years. There is no specific complaint except little disfiguring. He has not received any treatment, and he doesn't have any other swelling like this in the body or any other swelling. On examination, its site is dorsal surface of the right wrist joint. It is hemispherical in shape. It's approximately 2 centimeters in diameter. The skin over the swelling is normal as elsewhere, and there is no tenderness, and temperature of the skin over the swelling is same elsewhere, and when I felt it, it is smooth and edges are lifted. It is firm in consistency. Fluctuation is present in this case since it was a small swelling. So by means of my finger and thumb, I first stabilized it, and they also became the watching finger. And by the right index finger, when I pressed in the center, my two watching fingers, they moved apart in two planes. It is brilliantly transilluminant, some other, and when I applied firm pressure on it, to me it appears slightly reducible. It's not attached to the overlying skin because I can pinch the skins over it, but it is, although it is mobile, but it is attached to the deep structures. Because its mobility is not a lot, it's a slightly mobile, and it becomes less mobile when I do plantar flexion of the wrist. Surrounding tissues are normal and local lymph nodes are not enlarged.
What is your differential diagnosis?
Ma'am, my differential diagnosis, are ganglion, bursa, cystic protrusion of synovial joint, cystic protrusion of synovium from the joint. These are the three which I think of could be differential diagnosis.
Okay, what is your diagnosis?
My diagnosis is ganglion
Justify your diagnosis.
because it is firm, it is tense, it is present over the joint, and it appears to be attached to the joint, and it appears like as if it is arising from the joint capsule, which is a lot of fibrous tissue in it.
How can you say it's originating from the capsule of the wrist joint?
It is slightly mobile, but when I ask the patient to flex the wrist joint, it becomes more prominent and its mobility even becomes less. It becomes more tense, more prominent.
How will you investigate the swelling?
Since in my differential diagnosis, there are two more things, which includes a protrusion of synovial joint, which occurs only in cases who have arthritis. So therefore, I would like to have an X-ray joint, X-ray of the wrist, AP and lateral view.
What is the treatment?
Treatment is excision.
And why do you want to operate?
I want to operate because patient desires that it should be removed.
Okay, what are the complications?
Usually complications do not develop in ganglion except it slightly grows and it is unsightly, but that's not a complication.
How will you differentiate among the differential diagnosis that you have given?
You see, ganglion is tense and firm, it is not soft. Other two swellings, which is synovial protrusion and bursa, they are soft. So on feel, you come to know, okay, this is a ganglion or this is a synovial protrusion or bursa. Now once it is a soft, synovial protrusion does not occur in a normal joint, it occurs in an abnormal joint, and usually it is arthritis. Whereas bursa is also soft, but the joint is normal. Moreover, bursa usually is present where there is some friction between the joint and a surface. In the case of wrist, there is not much friction between the skin and the joint, so adventitious bursa could be produced to safeguard the structures underneath.
Thank you very much.
Thank you very much.